Now, about 1 in 8 U.S. women develop invasive breast cancer during their lifetime. The American Cancer Society estimates more than 40,000 women will die from breast cancer this year alone. And of course, men can also fall victim to this illness. This month, we want to focus on African Americans and how breast cancer impacts them. Now, to help us understand that, we have Augusta University's breast cancer surgeon, Professor Dr. Firdaus Ziauddin. Dr. Ziauddin, thank you so much for joining us here today.
Thank you.
Tell us a little bit briefly about what breast cancer is.
So cancer develops when cells become abnormal. So our cells are the normal basic building blocks of our tissues and organs, and they have controls on how much they divide and where they stay. Cancer cells lose those controls and divide uncontrollably and grow in numbers and can spread to other organs. Cancer can develop in almost anywhere in our bodies. Breast cancer is, other than skin cancer, the most commonly diagnosed cancer in women in the United States, with over 230,000 women in this country are diagnosed with breast cancer every year, and of those, about 28,000 are African American women.
How can first we detect, and we have a graphic of a carton of lemons, and it shows how we can spot it. Show us what we're looking at here.
So it's important to look for changes in your breasts and be aware of how your breasts look normally. Concerning changes in your breasts may be skin thickening, can be nipple discharge, which is illustrated on some of those lemons. It's not the most realistic presentation, but it does serve as a good illustration of some of the changes that can take place in the breast. Lumps, deformities which pull the skin in or retract the nipple. These are all concerning changes which you should bring to the attention of your doctor.
Absolutely. Now, how does breast cancer impact the African American community differently?
So in terms of incidence, the frequency of breast cancer in African American women and white women is almost the same, and perhaps slightly less in African American women. However, the death rate among African American women who are diagnosed with breast cancer is higher than it is among white women. The reasons for this disparity are complex and perhaps not completely understood. Part of the reason may be, breast cancer is not one disease. It's a set of diseases, some of which are more aggressive than others. There's a certain type of breast cancer called triple-negative breast cancer, which is a more aggressive variant, which occurs almost twice as frequently in African American women than it does among white women. That's not the whole explanation. I mean, there are other issues, perhaps access to quality screening and access to treatment. There are some factors we can control and some we cannot. It's important to take control of the risk factors which you can control. Maintaining a healthy weight, talking to your doctor, because obesity is associated with increased risk of breast cancer. Don't smoke. Smoking is associated with increased risk of breast cancer. Limiting alcohol intake, maintaining a healthy diet and weight, these are important and factors which you can control that can decrease your breast cancer risk.
Absolutely. Thank you so much for all of that good advice. Thank you for coming on. And of course, make sure you get your mammogram, correct?
Yes, and don't wait until you have breast changes like we illustrated with those lemons. Mammograms can detect breast cancer even before you have findings on your physical exam.
Doctor, thank you. Now